I'm Jeanne Crawford, and just to give a little story that just happened this last week with me about the insurance companies making money off of denying care. I had a teaching assistant. I'm a retired teacher, and she moved to the lower Central Valley, to Visalia, and she has health care insurance through the Covered California Obamacare. And she needed to have a pretty serious operation on her neck to have two vertebrae fused. They could not, in her network, find any doctor in the Central Valley that could do that surgery. She had to come up to San Francisco. Luckily, she knew me and she could stay with me. Then the insurance company, so first it was that network, then they denied for that surgeon here in San Francisco to do the procedure that he wanted to do, which is the most successful one. He had to do a different procedure that doesn't necessarily have quite so much success. And they said that they'd only pay for one night in the hospital. This is after a 6-hour surgery. And I mean, they insisted in the hospital that she stay another night. There was no way she could go home after one night. So they're going to fight that. But I mean, this is an example of someone who has insurance. So as you can see, it's quite a mess. What I'd like to say is so exciting about this new bill that Carolyn was telling us about is that it's being sponsored by Pramila Jayapal, who's from Seattle. She's a real energetic person. She organized last year, or she organized a caucus that was devoted just to Medicare for All, to get Medicare for All bill to come to be. And she's the sponsor of this new bill that Carolyn was telling you about. And she has really given it a lot more body, a lot more juice. It was a 30-page document before. It's been introduced every year since 2007. And this time it's 120 pages. It's also, because now it's much more popular in the United States to talk about Medicare for All. You've probably heard a lot of the Democratic candidates for president talking about it. A lot of our state officials are talking about it. Gavin Newsom's talking. I mean, so it's become an in thing. The problem is, they're also the pharmaceutical companies and the lobbyists and the insurance companies all are really scared and working hard to have a lot of false Medicare for All bills. And I just want you to know, I'm going to just go through 7 things. There's what Carolyn has already said, but there's 7 things that are only in the Medicare for All Act of 2019 and in any state bill for comprehensive Medicare for All. And those 7 things, one is universal, everybody's in, nobody's out. Everybody who's a resident in the United States is in. The second one is comprehensive coverage, which she went over a lot of the things that are covered, including, which is important to us getting older, glasses and hearing and teeth. I mean, I have met so many people whose health is affected by their teeth and they can't afford the care they need. The other is free at point of service, and I meant to bring in a little card. Everybody will have a little card. It's just the same size as your Fast Pass or anything. And that's what you'll show when you go to the pharmacy. That's what you'll show when you go to your physical therapist. That's what you'll show when you go anywhere. And that's it. No money exchanged. You have free choice of any doctor, any medical provider, any therapist, any hospital, completely. It's no longer tied to your job. So in other words, if you've stayed because you get health insurance with your job, you've stayed in a job that you hate, and you've done it because it covers you or maybe covers you and your family, now everybody's covered, whether you work or not. So you can leave that job and find something you really like. Also, it includes a just transition for those people, all those people who work on denying care for the insurance companies. And where I go to the doctor, there's a whole whole large office full of people who spend the time figuring out what insurance policy will provide for each patient that comes in and does all that paperwork. And then the doctors have to fight all the denials, all those things, all those jobs. There'll be a just transition for those people. So they will be provided with more education, with severance pay, with help to find another job. All those things will be covered over a 5-year period. And then the other thing that a bill has to have is a single pot of money. That's why it's often called single payer. So there'll be a single pot of money that will cover all these things. So those are the 7 things. And so don't get fooled by some of these bogus bills that are going to be coming out. The other thing I just wanted to say, and that ties in with a lot of what we're doing now, and actually what Carolyn and the nurses had happen this last week, and that is that we really want to pressure Nancy Pelosi, who's now Speaker of the House, to guide this bill through. And unfortunately, her chief aide has been heard talking to the insurance companies, reassuring them they have nothing to worry. And also, I mean, she wants to take the excitement about Medicare for All and show that she supports it, but she doesn't really support it. I mean, maybe as a goal way down in the future, but she sent it to, for the first time ever, it's going to have a committee hearing. She sent it to a committee that is not, I mean, it's great that it's getting a hearing. That's wonderful. But it's not one of the committees that it needs to go through in order to go to the floor and get a final vote. And there are 2 committees that it needs to go through, and she's not sending it to those. So it is wonderful it's getting a hearing, but the nurses have been really working on, and we had a great barnstorming meeting this last week, to mobilize as many people as possible to call Nancy Pelosi's office. And I have a little flyer here, and if you would like to call before you leave, we have a little script there of what to say. And they're doing this all over the country, so it's not just focused on Nancy Pelosi, it's also focused on getting co-sponsors. So last year, the bill had 124 co-sponsors, which is great. I mean, this is amazing. And Jayapal is wants to get at least that many with the new bill. So they're all over the United States. They're calling people to get their representatives to be co-sponsors. So the script on here is pretty generic for calling your representative. With Nancy Pelosi, I think it would be good to add to the script, please see it through to the floor of the House, or something like that. I just want to say that there's also going to be a California bill. And as you probably know, the last California state bill did not make it through both houses of the state legislature. And so there will be another, and I'm very excited and active in that campaign. So if anyone wants to know more about that, and that would be great. It's called the Healthy California Campaign. Okay, thank you.